Hi, my name is Dr. Nadine Hamoud. I am here today to show you what I talk to my patient whenever I do the LiNA hysteroscope procedure and what to expect. So I very like to use models so patient can understand a little bit what's happening and what we're doing. And I'm just going to walk you through my spiel with the patient from A to Z. So I start by explaining to them the ultrasound findings or the reason we're doing the LiNA procedure. We have a lot of condition and criteria and disease to use the LiNA procedure. But for the most part, whatever the reason is, I tell them that we're going to use a very small caliber tip that has a camera, and we would go through the vaginal area, through the cervix, and look inside of the uterus. I tell them it's like a real live camera that I'm actually looking what's happening inside of the uterus. I explain to them that the procedure itself, although it's uncomfortable, just like being in the examination room at the gynecologist, but it's not like painful. It shouldn't be painful. I always use cervical block. That's what I tell my patients, to like numb the cervix a little bit. It will decrease the cramping or the sensation that the patient might use. I explain to them that if they have any type of pain, it will be just like a period cramp, but it shouldn't be more than that. And even sometimes patients, I would be talking to them, like whether what I'm doing or even just like chatting with them. Some patients prefer that, and like they would not even be feeling much. And I explain to them that, depending on what we find, we do a biopsy or not. And I always tell them that I'm going to give them heads up to do the biopsy, just in case they feel a little bit more traction down there, they're expecting it. I explained to them that the procedure, depending again on what we find, depending on how easy we can to get in, should not take more than, honestly, like 5 to 7 minutes. Sometimes it takes much less. Again, depending on how the cervix reacts with us, how they react with the anesthesia, and how many polyps or what are we going to do. Then post-procedure, I also explained to them what I saw, what my expectations are. So also give them some expectation and heads up if I see something suspicious. I just start to prepare them that, hey, there's something that I saw and I took a biopsy and I want to send it. Or if otherwise everything looks fine. And this is one of the really good things about the LiNA, that I can same day, like almost like the same hour, I can tell patients, oh, this is why you have a thickened endometrium because of a polyp. It looked for the most part benign, but I'll send it to the pathology. After the procedure, I also tell them what to expect after the procedure. So first, I tell them bleeding or spotting is expected, and it can last any time between like a couple of days to 10 or 2 weeks, 10 days to 2 weeks. Different people obviously react differently, and depending on what we did. So let's say if they had like 3 polyps, then I tell them expect to bleed a little bit more. If they had, for example, atrophic endometrium and all I did was a biopsy, then honestly they are going to just have spotting only compared to like bleeding. I also counsel them that the bleeding should not really be more than a heavy period, and even if it's lasting a little bit more than like 2 weeks, to always let me know. I tell them also if they're having to change like a tampon or a pad like regularly, this is also not okay. I need to know about this. The other thing that I tell them to expect is some crampings. I always tell them that, hey, we actually irritate the uterus. The uterus is a muscle. So what do muscles do? They contract. So whenever we like put something in it, they might contract. So this is the whole idea why some women might have cramping. I tell them that it also should not really last more than 5 to a week maximum. And even actually the cramping actually gets better in a couple of days. They can take over-the-counter pain medicine, whatever they can take for their cramps. When they have their periods, should be fine. I tell them if you need to take anything more than that, or if the pain is not getting better, then I need to also know, so they can always call us. The other post-procedure expectation, I tell them like not to have intercourse and not to have anything per vagina for a good 5 to 7 days. But again, this is depending on how much I did. And it's not like they cannot have this, but for me personally, I always tell them that, hey, we already like this irritated the uterus. I don't want you guys to do anything more that might make either the cramps or the bleeding, so no strenuous activities. Just for like the first at least like 3 to 5 days, But if again, like I feel like I did a little bit more, like it has like a larger polyp, or I felt like the patient already has tendency to bleed, then I might extend this period of time depending on the patient characteristics. And the last thing, I told them that the pathology usually comes back within a week, depending on how quickly the lab can get it to us, and depending on the pathology, we'll have the next steps for the patient. Other than that, I always also send them with a pamphlet for the LiNA, so they can read a little bit more about it, what to expect, what not to expect, and what are the red flags. And I just ask them if they have any other questions, and for the most part, the patients feel that they are very well informed. Thank you for listening to me today, and have a good day.